Dr. Barber is a social epidemiologist. She's the assistant professor of epidemiology and biostatistics at Drexel University. And she's going to address the issues of social and racial injustice and disparities in our current health system and how universal health care can address many of these issues. One of the things that we need to keep in mind is that when we talk about health care and we want health care for all, medical care is just one part of it. Healthcare encompasses so much more. It encompasses poverty, all the poverty issues. It encompasses education level. It encompasses jobs. You know, what kind of jobs do we have? Do we have jobs with living wages? Do we have adequate housing in a clean and safe environment? Do we have adequate nutrition? All of those things are part of healthcare. So healthcare, does not exist in a silo off by itself. It includes all of those issues. We sometimes refer to those issues as the social determinants of health. But besides those, some of the major consequences of those social determinants of health fall directly on the poor, and quite often on communities of color. And so we need to take those things into account when we work for a just healthcare system, that we create the type of system that will help address those disparities and that will help bring equity and equality to all of us. And keep in mind, equity and equality are two different things. Equality, we all get the same thing. Equity, we get what we need. So we need to be addressing the human rights standards of healthcare in addition to just doing single payer. Single payer is a financing mechanism, but if we don't pay attention to the human rights standards, we can devise a single payer system that is just as horrible as the one we're living with now. I am very excited now to introduce to you Dr. Sharrelle Barber.
In progress.
Hi, everyone. Thank you so much, Deb, for that introduction and for the invitation to be with you all this morning. I am calling in from Philadelphia, Pennsylvania, so it's great to be here. It's this April 23rd. I don't know what happened to April morning. So I'm going to share my screen. Wait a minute. Are you all seeing my screen share?
Yes.
Okay, perfect. And let me make sure I have my notes. Okay. So, I want to again thank you all for just the work that you all are doing in the realm of healthcare for all in the state of Ohio. And as I was listening, to the history of the movement, both nationally and where you all are in Ohio, and thinking about, really just the power that movements have, and that you all have really taken kind of a long game approach to this work, recognizing that you take 2 steps forward and sometimes 3 steps back in this work, but it's necessary work and it's absolutely necessary. And so the way I have kind of framed my remarks, and I have a ton of slides because I'm a professor and I'm also a social epidemiologist, so I have a ton of data, is just some kind of from giving some background on, why it's so important to have a single payer health system from the point of view of a social epidemiologist who understands kind of some of the fundamental drivers of health inequities in our country, in our nation, and how, some of the systems of oppression really, make it so that there are those who are allowed to live and those who do not. And so today's talk, Pain, Power, Possibilities, Advancing Health Justice During the Pandemic and Beyond, Is a lecture that I've given in various places, but really trying to think about and unpack the insidious nature, particularly of racism and other forms of oppression, how that influences health and why. And I'll tie it back in at the end of why this matters for us so much with regard to advancing an agenda on universal health care. And before I get started, I just want to acknowledge that the land on which I do my work are the ancestral lands of the Lenape people, whose presence and resilience in Pennsylvania continues to this day. I take this opportunity to honor the original caretakers of this land and recognize the histories of land theft, erasure, and oppression that has us here. So back in February, I posted a tweet. I'm a tweeter. I turned someone who was anti-tweeting and turned tweet because it became my kind of microphone to get some of the frustrations out about the ways in which our society, our world really just devalue human life. And I put this tweet out on February 7th. It says that our acceptance of mass death is inhumane, period. And this was a couple of days after we officially kind of passed the 900,000 mark in terms of deaths, counted deaths related to COVID-19. And it was just so deafening. Our silence was just so deafening. And I think that this pandemic has really shown in so many different ways, our acceptance of mass death. That's not something that's new to the pandemic. It's just that it's been brought into sharp focus. And so I was reflecting on this, for an op-ed piece that no one wanted to publish, but I want to share a little bit of that reflection with you, just as I kind of situate my comments this morning. So on Sunday, May 24th, 2020, the headline on the front page of the New York Times read, "U.S. deaths near 100,000, an incalculable loss," accompanied by the printed names of 1,000 individuals who had succumbed to COVID-19, disproportionately Black, Latinx, Indigenous, poor, and working class people. It was a sobering reminder of the deadly consequences of reckless inaction. But as we approach 1 million deaths in this country, we are still eerily silent. Indeed, our collective indifference to this grim milestone has been harrowing. Even more troubling are decisions at the local, state, and federal levels to get rid of virtually all COVID-19 restrictions in a futile attempt to return to some sense of normalcy. And the most recent act of an unqualified Trump-appointed judge in Florida is particularly frightening, leaving millions of people unprotected, children who haven't been vaccinated, the immunocompromised, the elderly, individuals with pre-existing condition, individuals who rely on public forms of transportation. This acceptance of mass death is chilling, and the refusal of those in power to act in ways that are consistent with the current state of the pandemic is an indictment on our very humanity. And as I mentioned before, this is just one additional reminder of the ways that our society is a death-dealing society. And so this pandemic, the convergence of the racial and economic inequities that have kind of converged up against a backdrop of some horrific instances of state-sanctioned violence have really just brought into sharp focus the insidious nature of systems of oppression like racism, systems of oppression like exploitive capitalism, systems of oppression that have continued and have historically and continue to harm health, truncate lives, and make it so that there are certain segments of our population that are not able to thrive. So the work that I do studying racism and health inequities, particularly in the context of the United States and Brazil, it's been work that has sought to uncover and unpack the insidious nature of these systems and the ways in which too often our society disregards, devalues, and throws away certain segments of our population. And what we've seen in the pandemic is nothing that is really new. So this graph is a graph of deaths between Black and whites. And we've seen these inequities and racial inequities in health from the very beginning of collecting data on health. And so this is a graph that shows death rates for Blacks and whites from 1900 to the present. And as you can see, although the inequities between Blacks and whites have decreased, they are still persistent. And they are observed in this country across multiple disease outcomes here in the United States. So for example, of the 15 leading causes of death, Black Americans have higher death rates in 9 of them, including heart disease, diabetes, cancer, stroke, homicide, kidney disease, hypertension, septicemia, and liver disease. And Black Americans and other marginalized racial groups are also the same groups who lack or are not afforded access to quality healthcare, right? So this society literally shapes the conditions so that people that Black folks and other marginalized racial groups are sicker. And then the inhumane part of that is that they then deny them healthcare that would make them better. That's what I mean when I say we have a death-dealing society. Again, when we look at COVID-19 outcomes, we've seen the same patterns emerge, whether it's from infection, hospitalizations, and death. Marginalized racial groups in this country have borne the disproportionate burden of this pandemic. And this data from the CDC shows that it's been persistent and consistent across the pandemic, and it has just reproduced the entrenched inequities that we have seen for so many different outcomes across so many decades. We've also seen a loss of life expectancy over the course of the pandemic. And in particular, between 2019 and 2020, Black men lost 3 years of life during this period of the pandemic. And Hispanic men weren't too far behind, losing 2.4 years of life during this time. Again, another reminder, another way in which we see these striking racial health inequities. And so in my work, I understand that racism in this country, along with other systems of oppression, are really this country's underlying pre-existing condition. That the drivers of these persistent and striking inequities are not biological or genetic in origin, but rather are the byproduct of structural racism, and many of which these systems people encounter prior to their encounter with the healthcare system. And so this timeline was developed by a colleague and epidemiologist, Dr. Shawnita Seeley Jefferson, who's actually a professor at the Ohio State University in the College of Public Health. And she puts this together to really help us to see that if we really are going to deal with and understand the underlying root and historical antecedents of health inequities, that we have to, in this country, start with the institution of slavery that enslaved millions of Black people over decades, forced them into generations of free forced labor. We have to deal very seriously with the genocide and expulsion of Indigenous peoples from their ancestral lands. And we have to understand that history wasn't that long ago. And then that slavery shapeshift into what we know as Jim Crow segregation, that then shapeshift in what we know as what some would call colorblind policies that are not really colorblind. And that if we really take stock of the systems, the structures, and the policies that exist now, we would recognize that racism still shows up in our society and still limits the life opportunities of many marginalized racial groups in this country. As Clint Smith, who is a historian, puts, the history of slavery is the history of the United States. It was not peripheral to our founding, it was central to it. It is not irrelevant to our contemporary society, it created it. This history is in our soil, it is in our policies, and it must too be in our memories. And so Dr. Kamara Jones, who is a physician and who is someone who has been talking about these issues for years, many, many years in our field, 30 plus years in our field, even when she was ignored. She defines racism as a system of power that structures opportunity and assigns value based on the social interpretation of one how it looks. Because if you did not know, race is a social construct that we've made up. And this racism does three things that I think are really critical if we're really going to wrestle with these issues. One, it unfairly disadvantages some individuals and communities. And we will talk all day about that. We recognize it, we see it, and we're able to articulate that impact in certain communities. The last two, we don't talk about as much. And that is that it also unfairly advantages other individuals and communities. In our country, if we don't deal very clearly and very, if we don't, really take stock of how racism, is not just about the harm that it causes, but it's the advantages that it causes to certain groups. And if those groups aren't able to say, well, we need to, restructure this system, then we're not going to get anywhere when it comes to addressing issues of racism. And then the final point is that it saps the strength of the whole society through the waste of human resources. Racism is bad, and it's most harmful for Black people and people of color who have endured its harms for generations. But it also saps the strength of this whole nation when we won't deal with that past. And until we understand, and I think the pandemic has shown us this, nobody in this pandemic has been safe until we're all safe. The extent to which we allow the inequities in this pandemic to continue means we don't get rid of the pandemic. So the inequities that we are seeing literally is sapping the strength of the whole society. And until we see everyone sees themselves in this struggle, in this long struggle for racial justice and economic justice, then we will be lost as a nation. So this is putting again on my professor hat, because some people are like, okay, so what do you mean racism, is embedded as an underlying pre-existing condition? What does that mean for you? Well, it means that racism, particularly structural racism, is rooted in white supremacist ideologies, and it is upheld by racist policies, politics, and violence that finds its way into the systems and structures of our society. So that's where there is racial and exploitative capitalism, whether it's segregation and dispossession, whether it's our exclusionary immigration system that we don't talk enough about, whether it's mass incarceration and detention, extractive and polluting industries, and then our tiered healthcare system. All of these are both linked, so they're interlocking, they reinforce one another, and they lead to the conditions, work conditions, education, neighborhood environments, housing, all of the things that we know are necessary for health, right? And so unless we are ready to grapple and deal with that complexity, we're going to continue to see inequities in COVID-19 and inequities in so many different health outcomes that then show up in the hospitals the hospital systems and the healthcare systems in our communities. And so in essence, what I've really been trying to say is that racism in this country becomes embodied. And I like this quote from Tony in his book, Between the World and Me. It's a hard quote, but it's a necessary quote when we want to understand the ways in which racism shows up and harms health in our society. He says, but of all our phrasing, race relations, racial chasm, racial justice, racial profiling, white privilege, even white supremacy, serves to obscure that racism is a visceral experience that it dislodges brains, it blocks airways, rips muscles, extracts organs, cracks bones, breaks teeth. You must never look away from this. You must always remember that the sociology, the history, the economics, the graphs, the charts, the regressions all land with great violence upon the body. Our own individual bodies and our collective bodies. And during this pandemic, we have seen the pain of that embodied by so many who've been left out of this society. And so the work that I do on a smaller scale takes a piece of that to look at the ways in which segregation operates, right? And so again, we can't understand these health inequities unless we understand how these structures operate. For me, and in my view, and in the work that I do, I see segregation as one of the most visible manifestations of structural racism, especially in our urban areas. It's been pervasive, it's been persistent, and it is not by accident, but by design. There's been racist policies such as redlining, racial covenants, and even the exaction of violence in order to maintain and perpetuate segregation in our cities. And this has led to a host of harmful exposures, of intentional actions, of loss of opportunity, of exposure to pollutants and toxins that, again, really has an impact on health and health inequities in our cities. And so, yeah, I like that you all were doing somewhat of a history lesson on the healthcare movement within the United States, because I think it's important to take a historical perspective on these things. So in terms of segregation, we know that in 1968, we had the quote unquote Fair Housing Act that was fought for in the streets. That became, part of legislation. I heard you all mention Lyndon B. Johnson. Here he is signing the Fair Housing Act. What some folks don't know, maybe your group knows because you're more in tune to the work of activism and movements, is that the Fair Housing Act, I say it was paid for in blood because it came after 7 days, 1 week after the assassination of Martin Luther King Jr. That's how we got the Fair Housing Act here in this country. And that is unfortunately the truth of how we've advanced things, and made progress in the country, that it's often been paid for by the blood, the sweat, and tears of those who have come before us. But even the Fair Housing Act didn't have enough teeth. And in fact, even 50 plus years later, we are just as, if not more segregated than we were just over 50 years ago, with cities across the country experiencing high levels of segregation. And in my now home city of Philadelphia, it is one of the most diverse cities, but also one of the most segregated and one of the most divided in our country. And in Philadelphia, neighborhoods that are short distances, 2 or 3 miles apart, have life expectancy difference of upwards of 20 years in the city of Philadelphia. 3 months, 20 years of life expectancy difference. Wow. And in some of those neighborhoods, we have some of the best world-renowned hospitals like Penn, like Temple, sitting right in those neighborhoods. So what does that say about us as a society? What does that say about us in our cities and our states around this country, that we would allow life expectancy, 20-year differences in life expectancy to persist? And all this was happening before the pandemic. We know that, and just to give you some context around Philadelphia very specifically, so that's life expectancy. We also have instances of environmental racism very explicitly in our city. So this was a New York Times Magazine article that I was quoted in I guess this was now back in 2020. And it was talking about a community in South Philadelphia. Not sure how many of you are familiar with Philadelphia at all, but in South Philly, we've had an oil refinery that has been in that part of the city for over 100 years. And the story behind the oil refinery and the communities that it was impacting negatively, Black communities in particular, is that when the 1930s redlining maps were actually created in Philadelphia, the refinery was in a red line area because it was hazardous, right? But when the city decided where to place low income, mostly Black housing, public housing, they literally made the decision to put low income public housing in the shadows of this refinery. And the individuals and the families and the folks in this neighborhood have experienced all the things that you can imagine that are bad for health if you're right in the shadow of an oil refinery. Higher asthma rates, cancer, all of the above. And many of these same communities also lack access to healthcare. But again, this was a decision made by public policy folks to place Black people in harm's way. I also like to make the link between, hyper-incarceration and mass incarceration in health, because when we think about the war on drugs, that war we began to wage back in the 1970s, that criminalized and demonized Black communities, we can't understand kind of health and the harm that has just caused to families, individuals, and communities without understanding not only just those who have been in prison, but the literal extraction of human and economic resources, the extraction of civil and human rights, for example, voting rights, from those segregated communities. And the fact that police spending has increased from $42 billion in 1977 to $115 billion in 2017, despite the fact that crime has steadily decreased since the early 1990s. And this is really critical because that means that funds that could have been put into things like healthcare or housing or community development and investment were literally placed into death-dealing cages, jails, prisons, right? That have, again, reinforced the inequities that take place in our communities. And so when we fail to see how connected these things are, when we fail to understand this as a web of interconnected systems of oppression, then we will fail to really grapple with, this issue of health and well-being, particularly among those communities who have been most harmed. I would also like to, note that even with this pandemic, we have pushed the issues of those who are incarcerated and those who are detained to the shadows of this pandemic. But people are still going into jails and to prisons and dying, not because of a crime that they've done that would, I don't support the death penalty, but they're dying. They didn't go in there to die, but they're dying because of the ways the lack of healthcare, the unsanitary conditions in jails, et cetera. And we have pushed these folks to the shadows, even of this pandemic, even in the middle of this global public health crisis. And so just another point, this is more data, more visuals, but to show that, again, until we understand that kind of these connections between employment, for example, right? So we also in this pandemic have not done well by our workers, particularly low wage, quote unquote, essential workers who have been on the front lines, who haven't stopped working since the beginning of the pandemic. And we haven't made the connections between things like housing and neighborhoods and transportation and provided the kind of relief that's necessary to alleviate harm in those systems. And so early on in the pandemic, we did some data collection, some descriptive data analysis in Philadelphia, linking kind of redline communities to segregated communities to those that were structurally susceptible to COVID-19, and found that cases in those communities were higher early on in the pandemic. And the cases, deaths, hospitalizations, as well as in vaccine inequities have continued to follow the same geographic pattern in our city. So I know that's a lot of data, but that's what I do as a social epidemiologist. want to turn now to a report recently actually released by the Poor People's Campaign. It's called A Poor People's Pandemic Report, Mapping the Intersection of Poverty, Race, and COVID-19. This was a report that was done in collaboration with the Cairo Center, Repairers of the Breach, the Sustainable Development Network led by Jeffrey Sachs and Howard University. And what they wanted to try to do was basically show that during this pandemic, poor people, particularly, and communities of color have been the most impacted by this pandemic. Again, nothing that we're surprised by, but the data is still sobering. One of the points, or one of the data points that I thought was most striking from this report was that when you look at the various waves of the pandemic, those that were considered the deadliest, like the Delta wave, the wave in winter of 2020 to 2021, as well as this most recent Omicron wave, you see that the inequities between counties with the lowest median household income and the highest household income, the inequities were the most striking. So for example, during the Delta wave, the inequities in death rates were 5 times higher in low-income counties, 5 times. As an epidemiologist, that's striking. And these data, you can't explain the inequities at the county level by vaccination status alone. So a lot of folks are blaming, the inequities that we see. Oh, folks aren't getting vaccinated. That is a true statement. Also, there are so many barriers to vaccination that need to be unpacked. But these data, this 4-point time, the 3 times higher during the Omicron wave that, was purported to be affecting everybody, that can't be explained by vaccination status alone. And so we have to understand the broader contextual issues that might have been operating during these phases of the pandemic. This report also does a great job of showing how this played out in poor counties, but that have different racial makeups. So in Mingo County, West Virginia, for example, compared to the Bronx in New York, compared to Gillett County in Arizona, where there's a large indigenous reservation, and Hinds County, Mississippi in the Deep South, as well as Marathon County, Wisconsin in the Midwest, Harris County, Texas, that has a high proportion of Hispanic communities, and in Wayne County, North Carolina, which is where my father is based, you see, again, poor counties that have really striking inequities when it comes to COVID-19. And so we have to unpack, one, what were the issues related to access to healthcare, but we also have to unpack the local, state, and federal policies that did not include comprehensive mitigation strategies, public health mitigation strategies. And I know I'm talking to a lot of physicians and healthcare folks, but vaccines won't do it all. And we have to think about the public health infrastructure that was lacking, during the pandemic that really failed poor people in this country. We also have to think about the public policy makers who consistently throughout the pandemic failed our workers. Still workers don't have, many essential workers don't have a living wage. They still have to work in unsafe and unhealthy working conditions. They're still inadequate or non-existent worker benefits like health insurance, paid sick leave, and hazard pay. What we have done in the ways in which we have discarded workers during this pandemic, who literally fueled our economy when everything was shut down, is a disgrace. It's a disgrace that we patted them on the back and gave them pins and said, oh, we thank you for all of your work and your service, and have still left them to die unjust and avoidable deaths. There's a lot of blood on our hands. And this pandemic has just is magnifying, again, as I said earlier, that our society is a death-dealing society. And to talk about healthcare, We have to remember that before the pandemic, there were at least 87 million Americans uninsured and underinsured before the pandemic. And the thing that we're not talking about, death has been kind of the main outcome, which is devastating, heartbreaking in so many ways. What we're not talking about are issues related to long COVID, those who are having complications and disabilities now. And the fact that if folks didn't have access to healthcare before the pandemic, they still don't have access to healthcare. What is that going to mean for long-term consequences of COVID in our communities, right? We're not talking about that. And the same communities are being devastated and going to be devastated. So it's going to be a compounded, multiplicative issue of disability within our communities, and that's not being talked about. And then finally, I know we're talking about the situation here in the US, but the extent to which we have not also focused on global equity also continues to make it so that this pandemic will not go away. And there's so many implications that I can't get into during this talk about what that means, not only for the countries over there or in others places, but what it means for our country. Because again, none of us is safe until all of us is safe. We are all connected in this, and this pandemic has just shown that in so many ways. And unfortunately, we have not learned the lessons. We have not. It has been so hard. As someone who studies this work, as someone who came into the field, saying, public health is social justice, someone who knows what it means to have to count death. That's what I do as an epidemiologist. That's what we do. We look at data, we count death, we know the numbers, we look at the causes, and we still haven't woken up. Your fight is so essential now because people still haven't woken up to the fact that people need access to healthcare, point blank, period. There's no way around it. And if after a global pandemic that has wreaked havoc on Black communities, Indigenous communities, Latinx communities, poor communities, if we don't get that now, then we'll never get it. And that is an indictment on our humanity. So I've shown a lot of data, but to remind you all, and I know there might be people in this room who've lost folks to COVID, but our failure to act justly and our failure to act humanely is being measured in lives lost. This woman is Miss Pamela Rush. She's a 49-year-old Black woman from Lowndes County, Alabama, who was poor, but also an outspoken critic of the systems that ultimately led to her own untimely death. Within the Poor People's Campaign, I worked with the Poor People's Campaign as the Health Justice Advisory Coordinator, brought together some colleagues from around the country at Harvard, UCLA, and other places. Ms. Pamela Rush was the first casualty of the Poor People's Campaign back in 2020. Ms. Catherine Flowers, who does work around environmental justice, had this to say about Ms. Pamela. She said, this year, COVID-19 has swept through Lowndes County like a brush fire. Poor people, and especially poor Black people, fell victim in alarming numbers. Brazen politicians have actually called for people to die to protect the economy. In Lowndes County, that's exactly what has happened. Poor essential workers are dying to save the very economic and social structures that trap them in poverty. It wasn't long before Lowndes County had the highest rate of COVID-19 in Alabama. Many people were infected at the factories, the warehouses, the nursing homes, or stores where they worked. They didn't have the luxury of telecommuting. Flowers goes on to say that then, like a heat-seeking missile, the COVID-19 pandemic zeroed in on Pam. When she developed breathing problems in June, she was admitted to a Selma hospital and then transferred to the University of Alabama Medical Center in Birmingham. That's where she fought for her life for a few days before she lost the battle on July 3rd, 2020. The official cause of death was COVID-19, but the underlying causes of her suffering were poverty, environmental injustice, climate change, race, and health disparities. They would never be listed on her death certificate. This pandemic has been painful. And I just want us to sit and acknowledge that it's been painful. Close to 1 million deaths, probably already over 1 million deaths in this country. Over 6 million deaths around the world. And it's been painful, not just because of the unjust and avoidable death, but because it seems as if we don't even care. Policymakers, decision makers, people are just rushing back to normal, as if normal was ever serving us all. And so your movement and what you're doing in the state of Ohio and around the country is needed now more than ever. The question really for us in this moment, as hard as it is, as exhausting as it's been, is what are we gonna do with the death? What will we do with the suffering? What will we do with the pain? Will we choose in this moment to turn that pain into power? I contend that those of us who remain, those of us who are yet living, must honor the dead. We have to honor the dead. And we have to do that through bold, collective movement, radical, ground-shaking work. We cannot go back to business as usual. We must do work that is in service to life, that is in service to communities, that is in service to movements, demanding the kind of radical and transformational healing that this nation needs. We must declare, just like the Poor People's Campaign, that everybody has a right to live, and we have to stand up and fight for a way forward that centers equity, that centers justice and dignity, and that redresses centuries of policy violence and honors our shared humanity. We all have a role to play in dismantling these oppressive systems. So one of the principles that has been guiding me over this last couple of years and has also guided the work that we're doing at Drexel in the establishment of the Ubuntu Center is the concept of Ubuntu, which is a South African principle that literally translates to means that I am because we are. It recognizes that we are all inextricably linked, that we are caught up in an inescapable web of mutuality. And not only is my humanity wrapped up in your humanity, but it is so much deeper than that. It recognizes that my divinity, my very soul, is wrapped up in your divinity. Because deep down inside, we all come from the same life-giving, creative force that was breathed into us on the day of our birth. And when we get that fact, when we really get that in our innermost beings, then we realize that when we link up, or when I link up my life force with your life force, and we connect with this larger, ultimate, life-giving force, then we can be a force to be reckoned with in this moment and beyond. That we can wrestle life out of death. That we can wrestle light out of the darkness. And that we can wrestle hope out of the deepest despair. We can birth new worlds, new possibilities, and new futures. We do have power. If only, in the words of Amanda Gorman, we are brave enough to see it. If only we are brave enough to be it. And I contend that in this moment, it really is the only way forward. Justice demands nothing less of us, and our collective lives depend on it. Thank you. Thank you. Thank you.
You've made a tremendous impact on people here today, and we want to thank you very, very much for
Absolutely. Thank you.
presenting that information to us. It gives us a lot to reflect on. And the other thing that we want to consider too is how are we going to use this information in the work that we do in the future? So we've got about 10 minutes for questions. Okay, I've got one from Mindy.
Do we have your presentation? Is that available to us?
She wants to know. The whole presentation has been recorded and will be on our YouTube channel within a couple weeks, a week or so. But the question was, can we have your presentation? I warned you on that one, didn't I?
Yeah, I'll create a shareable version. Absolutely.
Okay, thank you. Send it to me, and then I will we'll make that available.
Thank you for your presentation. I wanted to know, how would this look like going door to door, house to house, trying to register people to vote and to participate in the electoral process?
So I think it's a combination of things. The electoral process, I don't know. I mean, we have to fight. So one of the things, and I didn't get into this here, but the fight for the health and the life of this democracy, right? And I say that very carefully because the democracy hasn't worked for so many years, but it's still on the line, and it's still very fragile, and we have to be fighting for that, right? To have at least a foot in the door and recognize that electoral politics can't be the only part of our work, right? So electoral politics, we can't ignore the fact that it's I'm sorry?
When you go door to door to talk to people who don't participate, who recognize the frailties of voting, how do you use this presentation that you've given to try to encourage them to participate?
Got it. How do I don't know. It's so hard, in terms of, creating a digestible version of this. This is a lot of, but I do think that it can be leveraged when we think about, everyone has lived a pandemic. Everyone has seen the pandemic. People probably have stories that are connected to their family members, community members, et cetera. I think leveraging what we have seen in the pandemic as a way to engage folks at, what we have seen, even the unjust and avoidable deaths is a failure of policy. That can be framed in a way that could potentially help people to see just what the literal deadly consequences of public policy violence is, right? So one of the reasons the Poor People's Campaign released this report, I was with them in Washington, D.C. back on April the 4th. They released it to kind of, help as a way of mobilizing. Look, this is one example of the ways in which, how deadly these systems are. And we have to hold our elected officials, those who have power, accountable for this death, right? So I think in that way, it could be leveraged in order to really show the connections or make the connections between your participation in the electoral process and how it then directly impacts individuals, families, as well as communities.
So you've got another question here? Okay, one more, Deborah.
Yeah, actually, what I wanted to do was respond. My name is Willa Evans out of Cleveland, A. Philip Randolph Institute. And what I wanted to say to the young, that was Sheila, to the young lady, the question you asked is when going door to door, just like what we do with voting, we have to make the issue personal. It's not about Republican or Democrat or what they think. It's about how it affects us in our communities, how it affects our brothers and sisters, how it affects our nieces and nephews. And when we do that, that's how we get people. Because just like with voting, people are registered, but not everyone votes because they don't think it matters. We have to give them a reason. She gave us some excellent points. I took pictures of them. Thank you so much for your presentation. But we have to make it personal.
Absolutely, thank you.
I noticed on some of the materials that you showed that you applied some critical race theory analysis, and I wanted to know if you see it as a threat that there are now something like 10 and increasing numbers of states that are, quote unquote, banning the teaching of critical race theory, and in other words, effectively censoring what people like you are saying, at least in the schools, in the public schools.
Yeah, absolutely. And I mean, I think it's a attempt not to face our past, not to face the truth of our past, right? And one of the things that I also think that in some ways, it's also a distraction. It's we definitely have to address it. And then I also think it's being used as a tool of distraction as well. So it's definitely, harmful, and we, need to be fighting the censorship and censoring. And it's just like, what are folks diverting from, and how are they using it as a tool to mobilize, a certain base, right, in that will, benefit them politically in the long run. So I think I definitely think it's absolutely critical, no pun intended, to frame, and really what critical, I mean, at the core, and the way I've used it in public health is that it helps to point to the systems, the structures, the policies, that have their roots in racism and white supremacy. And this history, this legacy that we have to deal honestly with, right? We cannot ignore it. As the quote I said from Clint Smith, like, it shaped where we are today. And, the real healing will only come if we face that history and help, move us, and then move us and move forward. But we got to face that legacy. We have to face the history. We have to face the laws, the policies that got us here so that we can move forward. So is it a threat? Absolutely. I also think it's a tool of distraction in this moment. I'm going to keep saying it, until someone fires me or whatnot. But for now, I think it's so necessary in order to just do this work and tell the truth unapologetically.
I would just like to point out that an important facet of the difference between African Americans and Caucasians is the role of inheritance. We look at our colleagues and we see the kind of car they drive, their lifestyle, the kind of house they live in. what we never know is how much of that was really inherited wealth.
Right,
And,
yeah.
and that's a big difference between African Americans and Caucasians.
Absolutely, and I didn't show that there's I teach classes on this and everything, but when we think about what happened, not only with redlining, but the GI Bill, the New Deal, all of that literally set up, kind of wealth in this nation for white folks, that denied wealth to Black folks, and the billions over generations that has been lost just from housing alone. It is remarkable. And it just, reinforces why we need to be understanding and unpacking this history.
So just a real quick comment. Somebody told me from the audience that our schools are not teaching critical race theory. That's actually graduate student stuff. And what we're just trying to talk about is race. And even that seems to be something that many states are not allowing us to do. So.
Right. Yeah. So because it's a law theory, really. So yeah.
Right. Thank you so much. I think we're on the quiz here.
Thank you. Thank you so much.